Hello, my name is Allison. Today we are going to be doing an eye examination on Amy here. She's going to be my patient. First we're going to be going over some palpations of the face, and then we'll do some eye exams and some general inspections, what to look for, and the structures of the eye, the anatomical structures. So first we're going to start with the palpations of the face. So first I'm going to come up to the frontal bone. I'm palpating for any deformities, divots, anything like that. I'm going to come down to the zygomatic bone, which is a cheekbone right here. I'm going to go around the orbital margins, which is around the eye. I'm going to go to the nasal bone, and then the cartilage, which comes down. The maxilla is the top part of your jaw. The temporomandibular joint is around the ear. If you go ahead and open and close, you can feel it move. The mandible is your jaw. You want to inspect the teeth just to make sure. Go ahead and smile for me. Beautiful smile. Then we're going to come to the paraocular, which is the ear, and the external ear. And then if you look up for me, then you come right underneath the Adam's apple is the hyoid bone. Next we have just general anatomy of the eye. We have the globe, which is the eye itself. We have the sclera, which is the white layering in the eye. The iris, which is typically the colored part of the eye. Pupil is in the center, the dark part around it. The conjunctiva, which is a layering across the a mucous membrane that covers the sclera. And we have the cornea, which is helps focus the light through the eye. We also have the retina, which is in the back of the eye, which contains the nerves and the arteries and the blood supply and stuff like that. And we have the optic disc and the optic fovea, which are inside the eye, which I will be doing an examination on that later. Okay, so next we will be doing a pupillary reaction test. I will be testing the dilation of her pupils, making sure that they are both equal dilation. If there was like a blunt force trauma to the head, there might be abnormal dilation of one eye or the other. So with this, I'm going to use the pen light. I'm going to have her look at my ear, and what I'm going to do is I'm going to shine the light going from lateral to medial, and what I'm looking for is the constriction or the dilation of her eye, of her pupil. So go ahead and look right here. I'm going to come around. And it's quick couple seconds, making sure that you see the reactive pupil. So then you're going to do the other eye right here. And it should be in a darker room, but we have light coming through typically to see, get better reaction from pupils. Next we will be doing an eye tracking, which will test the muscles in the eye. We have the superior rectus muscle, inferior rectus muscle, the medial and lateral rectus muscle, which moves the eye up and down and left to right. And we also have the superior and inferior oblique muscle, which is a circular, which moves it from downward and outward, and upward and outward. So what I'm going to have her do is I'm going to have her follow my pen light, and I'm going to go into the different quadrants, making sure that we have both reactive movement in the eye. So first I'm going to start in the center. I'm going to have her, without moving your head, I want you to just follow with your eyes, okay? Mm-hmm. So you're going to come right here, come up, and down to the sides, come up. Good. So she had equal movement of it. Sometimes if there was an indication of injury, there would be abnormal tracking, or there might be a lazy eye that doesn't follow exactly where it's going. Okay, so next we are going to be doing another eye exam using the ophthalmoscope. This is going to help look through the pupils into the retina. When looking at that, we are looking at the choroid, the optic nerve, the fovea, and the arteries and stuff that is located in the retina. So first we're going to turn it on, and you're going to be able to see the light. This little dial right here will help brighten it and dim it. So first we're going to make sure that the light's working. Next I'm going to make sure that the lens is focused enough for me to look through. I will be using this dial on the side to help determine to make sure that it is in focus. So as we are going through this, we are going to come over here, and we're going to have I'm going to have Amy pick a spot about eye level. Just keep looking at it. I'm going to come over with my left hand. I'm going to place it on her forehead. I'm going to come around and look through it with my right eye. I'm looking through the pupil to look at the back of the eye. And what I'm looking for is the optic nerves and the fovea. Typically it doesn't work as well if the eye is not dilated. Usually there's a dye that's put in that will help relax the pupil, and we'll get a better reading of it. For this purpose, we obviously don't have dye, and it's a lighter room. Usually it's typically in a darker room to get a better accurate reading of it. We're doing a eye acuity test using the Snellen eye chart. So it should be 20 feet away. We will have the athlete or patient 20 feet away. They will be using a device or hand to cover one eye. I will have her read the first line. Go ahead and read the first line for me.
E.
Okay, and then move down to the next line until you can't read it.
D-E-F-P-O-T-E-C.
Okay, so we had, she messed up on line 3, so she would have a 20/70 vision. I did forget to ask, do you wear glasses or contacts? Okay, so you're going to cover the other eye, and we're going to do the same thing. So you're going to start from the very top, and you're going to read down.
E-F-P-T-O-Z-L-P-E-D-P-E-C-F-E-L-O-P-Z-D-D-E-F-P-O-T-E-C.
Is that as far as we can go?
Yes.
Okay, so we're going to come over, and we will see that she has 20/20 vision. This is doing, once again, the eye acuity test, and this is called the Snellen eye chart.